Vertigo or dizziness. I'm going to share with you some important information, 2 things you can do to test whether or not it's coming from your neck and what you can do at home in order to get rid of it. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. As a chiropractor, there's a few things that I see a lot. Not only low back pain and neck pain, but it's vertigo and dizziness. And so anybody who's suffering with this understands it is extremely troublesome. It's extremely heartbreaking to know that it's hard to even not only sleep, you're worried about getting up, tossing or turning in bed is extremely difficult. Getting to work, driving, it affects everything. And so what I want to do is go through a few things that you really should be looking into to know whether or not it's vertigo, or how do you know if it's dizziness. So one of the main characteristics of dizziness is that you are dizzy. It is you feel like you are uneven. You feel like you are going to fall. You feel that it is coming from you and that the imbalance is there. And that would be like as if you're on a teeter-totter, or if you were going around in a circle, you would feel uneven even though the ground feels pretty solid. With vertigo, it is the opposite. It is that you feel completely where you should be, but the world is turning. The world is flipping. And a lot of the times your eyes will do specific movements to show you that it is trying to find equilibrium. It's trying to understand where you are in space, and it can't figure it out. And so there's 3 main areas that your body gets information, your brain gets that information to know where it is in space. It's called proprioception. And so the major area that a lot of people with dizziness or vertigo understand is the ears. And so when you go to your family doctor, you ask them, you tell them what you have, they're gonna right away tell you about your ears, an imbalance in the ears. And generally there's the Epley's maneuver, which is a maneuver that a lot of people learn in order to get the crystals inside the ears to settle down, to stop stimulating the hair receptors inside your canal, so that way you're not overstimulating your body and hence getting the vertigo or the dizziness. However, in my experience and with a lot of the patients that come in, what I'm noticing is, yes, they might have the ear imbalance, but generally it's coming from somewhere else. So the 2 other areas that your brain gets the information from is going to be your eyes. And so looking at the horizon, making sure, so there's generally, you can have eye strain, you could have had eye surgery, you could have had an accident, you could have had something that disrupted the eyes and why your brain is having a hard time. But the other one is your neck. And in fact, this is the most common one, because if we look at the receptors in the top of your neck, so the 2 top bones there, those 2 top bones are responsible for sending a ton of information to your brain about where your body and your spine is in space. And so if those areas are stuck, if they're out of alignment, well then they're putting extra pressure, and that pressure is going to result in a disturbance to your equilibrium system, which just so happens to be just above those bones in the part of your brain. So the cerebellum, the part back here, is no longer now able to process the information because the bones are out of place. So as a chiropractor, we do an assessment and we check. So I'm going to show you 2 things you can do at home using, one, a thermometer, and the other one is if you have a swivel stool, then that's what you want to use. If not, I'll show you a modification to do that. So the first test is using a thermometer. So now obviously not the ones you're going to put in your mouth. You do need one that you can get information from the skin. So this one uses a temperature scanner, and you can buy them for the forehead or whatnot. So what you want to do is you want to point the scanner right underneath the earlobe, right in here. So right underneath the earlobe, right in here. So that's called your atlas. That's the top bone in your body, and that's the one that your head sits on top of. That's the one that usually causes the problem, but if not, it could be the second one. So what you want to do is you want to take a reading from one side. You want to see your number. Then you're going to take a reading from completely the other side. Same spot though. You really want to make sure you're around the same area. So there's a bone back here. It's called the mastoid. You want to go right underneath there. In fact, you can sometimes even feel that bone on you. Now, if that bone is already tender, there's a high chance that it's out of alignment. But then what you're going to do is, without touching it first, so don't irritate the skin, meaning you're going to have more heat. Don't touch it. Scan, scan. When you read the number, you should be looking for a difference of no greater than 0.2 of a degree. So generally what I'll find is some people, it'll be like 97 on the right and 97.3. So that 0.3 difference means the bone is out of alignment. It is that sensitive. So you want to be 0.2 or less, as close to equilibrium as possible, telling you that the bone is perfect. So if you're suffering with vertigo or dizziness, you're going to take one reading on this side, run on the other, measure and check. Do it again 3 times. You need to get a baseline. Now, if that bone is off, go see a chiropractor. It's really simple. Go see a chiropractor, get the proper assessment. If the bone is misaligned, the chiropractor will do the absolute wonders of realigning your spine, taking pressure off the nervous system, allowing your body to be able to hold itself up in space, because now the information is equal. And then you can even retest that after you get your adjustment, and you'll be able to see that it's equal. So that is a simple test you can use at home. You can also move down to the second bone. And when I say move down to the second bone, if you're taking a reading right here, well, the second one is literally a finger, point of a finger down. You're just going one step down. It's not very far. So you would take one here, repeat 3 times, get your measurement. And if you want to, you can also do C2. If, again, those numbers are off, most likely your vertigo or your dizziness could be coming from your upper spine. But the second test you're going to do is the swivel test. And now we're checking to see if I get the readings using the thermometer and I'm noticing, okay, my spine is out of alignment. It could be the reason why I'm getting it. Now let's test it. So the other test that you could do is the swivel test. So you could do the standing one, or you could do the actual one on a swivel. So very simple. You have a swivel stool or a chair that can turn side to side. What you want to do is keep your head looking straight. You're not turning your head at all. We're only getting movement from the torso. So this is what it would look like. So we go side to side, and I'm turning my body, I'm turning my legs, I'm trying to get movement down below my head, but without moving my head. Now, if I'm doing this, and all of a sudden, see, I'm not even moving my head, but I start doing this, and all of a sudden I go, whoa, I'm getting dizzy. You know that your dizziness, your vertigo is coming from your neck. Another reason to go see a chiropractor. So if I'm turning like this, and all of a sudden I go, whoa, I'm starting to get vertigo. My eyes start to go. I'm getting that feeling again. You know it's coming from your neck. And a lot of people who have experienced car crashes will tell you, especially if they've had any type of whiplash. So the muscles in their neck are sore, they're broken down. They got the SEM, this muscle. That muscle is one of the most commonly strained muscle when you get into one of the accidents, right? With your head, and your head bobbles. And so this muscle is actually could be sending the wrong signal. It's strained and it's causing the dizziness or the vertigo. So an easy stretch, here it is, here's the solution. An easy stretch for this muscle. Right away what you want to do is you want to turn your head to one side. You want to arch back just a little bit. Now if you got vertigo or you got dizziness and this is what's causing it, you're going to notice that, let's say you're laying in bed and you turn your head to the left, you're going to notice that when you turn your head to the left, you're getting the vertigo. So if I do this and this, well, we know 2 things. 1, the affected side is the left side, so I'm turning my head to the left. But 2, it's the muscles that could be causing it. So as I turn like this, make sure that you're sitting in a chair or that you're in a bed, a place that if you have to fall, you're uneven, you need to do that. Make sure that you have something close by or that somebody else is there. Never do it standing, and definitely not on your own. So bring it back like this, hold for a few seconds, and all you're doing is stretching that bone, or that muscle right there. So this is called the Sternocleidomastoid, or the SCM. And then you can also repeat on the other side, but generally you want to do the affected side. So, and you'll notice the muscle is pretty tight. Now that we know it's coming from your neck, one of the things I want you to do is to now put pressure on the bone in the top of your neck, and you're just gonna hold that for 5 seconds. You're not holding it long, you're not jabbing it, you're not pushing into it, you're not trying to get a popping sound, nothing. It is purely just pressure, and it's purely coming from the side. So I'll show you what that looks like. So if you did the pressure, or if you did the thermography test and you found that it was off, you did your swivel test and you know now that it is coming from your neck, then what you want to do is you want to go to the affected side. Affected side meaning the side that you notice that when you're laying down on your back and you turn your head, let's say to the left, and it causes the vertigo, but not the right, then you know the left is your affected side. So then what you would do is take your thumb, you're going to place it right over here, so right behind your earlobe, and all you're going to do is you're going to push into it, hold for 5 seconds, and then release. That's it. That is the treatment. That is the test. Now, if all of a sudden you notice that you feel a lot better, your sweats start to go away, you start to notice that you're a little bit more calm, a little bit more balanced, then you need to go to a chiropractor, because they need to adjust that area to correct the problem and, more importantly, create the balance that you're looking for. Based on those tests, you're really determining again whether or not it's coming from your neck, whether or not it's coming from your ears or your eyes. Now, one of my specialties is the neck, and we're looking at the neurology behind that. So if we can create balance within the skull, the way the skull sits on top of the body, and more importantly, balance between the first 2 upper cervical spine, what that means is now your brain's getting the proper information and your vertigo will go, or your dizziness will go. But there are a lot of reasons why people have these issues. It could be blood sugar issues, it could be electrolytes, it could be even just not enough water during the day. I mean, there's so many different conditions and reasons why somebody would need to go to a health specialist that I'm going to encourage you. Talk to your doctor, get the referrals. If you live in a place that you can get access to a chiropractor, go get an assessment to figure out whether or not it's coming from your neck. But I can tell you, if you do the first 2 tests, which is the swivel test, either standing or on a stool, or you use the thermometer, if you start getting these readings and you start noticing that these are what's causing the problem, then go to a chiropractor in your area, get the proper assessment, and if you have a misalignment that's causing this issue, then you will feel the difference. If you have a question or comment, you can leave it down below, and I thank you so much for watching. Don't forget to like, subscribe, and share this information with the people we know need it the most. Until next time, we'll talk to you soon.